Hello, Dr. Poffenroth, and all my fellow human understanding students. My name is James Fitzpatrick, and I will be presenting today about antibiotic overuse and the emergence of superbugs. Antibiotics, in particular penicillin, were first discovered by Alexander Fleming in 1928. The discovery of antibiotics completely changed the paradigm of our relationship with infectious bacteria. It gave us a viable way of fighting back against them and drastically reduced the mortality rates associated with many bacterial infections. Mr. Fleming's particular antibiotics worked on gram-positive bacteria that cause scarlet fever, pneumonia, meningitis, staph infections, and tuberculosis. However, in the modern era, we are seeing bacteria emerging that have an innate resistance to these antibiotics, or better known as a superbug. As mentioned before, a superbug is basically a bacteria that has developed resistance to the antibiotics previously used to treat it. They are fast becoming one of the largest problems facing modern medicine. They include MSRA, E. coli, Salmonella, and multi-drug resistant tuberculosis. Now I'm going to go a little bit more in depth about one of these superbugs in particular, MRSA. MRSA stands for Methicillin-resistant Staphylococcus aureus. It typically manifests itself as a skin infection. It was first discovered in 1960 and was believed to be a medical idiosyncrasy. In the years following, it was primarily diagnosed in intravenous drug users, but today it affects even healthy people, regardless of age or situation. Some of the more severe symptoms of MRSA are chest pain, a cough or shortness of breath, fatigue, fever and chills, a general ill feeling, headache, rash, and wounds that do not heal. The picture you see is an example of a rash caused by an MRSA infection. Another superbug worth mentioning is MDR-TB. MDR-TB stands for multi-drug resistant tuberculosis. Tuberculosis in general is airborne, and even more than that, it's very hard to spread from contact. It typically spreads from particles of the infection being released into the air, where they are breathed in by a new host. The reason why multi-drug resistant tuberculosis is so virulent is because it is resistant to both isoniazid and rifampin. And these are the two most popular drugs to treat tuberculosis with. Furthermore, according to the World Health Organization, there were over 650,000 cases just last year. Because of this resistance to the most effective and popular drugs, it can take over 2 years to treat this particular strain of tuberculosis. Some of the symptoms of multi-drug resistant tuberculosis are feelings of sickness or weakness, weight loss, fever, night sweats, coughing, sometimes even with blood, and chest pain. And I'm sure the biggest question on everyone's mind is, how exactly did this happen? How are these superbugs coming to be? And this chart gives some simple examples of how this problem has came to be. So, animals get antibiotics and develop resistant bacteria in their guts. The drug-resistant bacteria can remain on meat from animals, and when this isn't handled or cooked properly, the bacteria can spread to humans. Or fertilizer or water containing animal feces and drug-resistant bacteria is used on food crops, and that same drug-resistant bacteria in the animal feces can remain on the crops and be eaten, and then these bacteria remain in the human gut. The other way is a little bit more direct. And in this chart is given by an example with a person named George. George gets antibiotics and develops resistant bacteria in his gut. And George stays at home and in the general community and spreads the resistant bacteria. Or George gets care at a hospital, nursing home, or other inpatient care facility. Resistant germs spread directly to other patients or indirectly to unclean hands of healthcare providers, and the patients go home. Or resistant bacteria spread from other patients from surfaces within the healthcare facility, and patients go home. But on the most simplest level, using antibiotics is what creates resistance. And these drugs should only be used to treat infections. It is also important to note that by some estimates, fully 86% of all antibiotics used are within our livestock system. This is particularly prevalent because of factory farming, in which animals are kept in close proximity of each other, further leading to the spread of bacteria in general, as well as resistance. This leads to a perfect breeding ground for resistance. The easiest way to think about this is from an evolutionary standpoint, in which they are creating an environment in which only resistant bacteria are able to survive, and as a result, these bacteria are allowed to spread because of that close proximity. For doctors, in general, we see an overprescription of antibiotics, especially within developed countries, and there's a direct correlation between overprescription of antibiotics and resistance of bacteria. Again, leaning towards from an evolutionary standpoint, what we believe would happen. Also, in my research, I came across the idea of medical externality. What this basically is from the doctor's standpoint, they have only a fiduciary duty to that particular client, and they aren't thinking about the human race as a whole. And as a result of that, even if they feel they may be overprescribing medication or misusing antibiotics, they do not feel that their individual actions affect the larger picture. And with most doctors doing this, it obviously does affect the larger picture. You also see the misdiagnosis. Someone comes in with respiratory issues and they're prescribed antibiotics even though they do not, in fact, have an infection. And also from the patient's standpoint, you see a lot of people requesting antibiotics, and again, this is something where someone comes in with a cold and they want antibiotics, and many times doctors will oblige when patients particularly request for antibiotics. Another big issue is that oftentimes patients don't finish their antibiotic prescription, so they'll start feeling better and they'll stop a few days before their antibiotics are finished with, and this allows any bacteria that's left to resituate itself, and that bacteria will have a larger proportion of resistance than before. And lastly, for all people in general, not exercising proper hygiene really leads to the spread of these bacteria. In conclusion, I really hope that this presentation helped you learn a few things about superbugs, as well as how they are caused. The only way to fix this problem is for us to fundamentally shift our attitude towards antibiotics, drastically reducing the amount that we use. In this situation, too much of a good thing is really a bad thing. Thank you.